Have you had an unexpected birth control failure or unprotected intimacy and need a safe backup option? In this video, we'll explain how Plan B one-step works, how to use it properly, potential side effects, and important health tips in a clear, respectful way. What is Plan B one-step? Plan B One Step is an FDA-approved emergency contraceptive pill available without a prescription in the U.S. It contains levonorgestrel, 1.5 milligrams, a hormone that helps prevent pregnancy when taken within 72 hours of a contraceptive failure. It works mainly by delaying ovulation, which helps reduce the chance of pregnancy. It's more effective the sooner you take it. How to take it safely timing. Take one tablet as soon as possible, ideally within 72 hours of the incident. Food. You can take it with or without food. Vomiting. If you vomit within 2 hours of taking it, consult a pharmacist. A second dose may be needed. Ongoing protection. This pill doesn't replace your regular method of contraception. Continue your normal method after taking it. Possible side effects. Plan B is considered safe for most people, but temporary side effects may include mild symptoms, nausea, tiredness, or headache, spotting or changes in your next period, mild abdominal cramps or breast tenderness. When to seek help. If you experience severe lower abdominal pain days later, seek medical advice. This could indicate a rare condition. Warnings and health advice. Plan B will not affect an existing pregnancy. It's not an abortion pill. It does not protect against STIs, sexually transmitted infections. If your body weight or BMI is high, its effectiveness may be slightly reduced. Consult a doctor about other options. This method is for occasional emergency use only, not as a routine method. Conclusion: Plan B. One Step is a helpful backup for those moments when your regular method didn't go as planned. Always use responsibly and talk to a licensed healthcare provider if you have questions about what's best for your body. Found this helpful? Like, share, and subscribe for more reliable health education content.